Welcome to the deep dive. Today, we're really getting into something important: mental health support for our veterans.
It's definitely a critical topic.
Yeah, we've been seeing some, well, concerning trends about mental health diagnoses in active duty personnel, and we want to explore some of the pathways to healing, some of the support that's actually out there.
Absolutely. And we've got some solid information to work with. There's a recent Defense Health Agency report, for instance. It shows a pretty significant increase in mental health issues among active duty members.
Okay.
And then we'll look at organizations like Reboot Recovery and, importantly, rapid mental healing for veterans, especially how they're, working together on trauma recovery.
Right, exactly. So our mission today really is to get a handle on the scale of these challenges and then see how groups like Rapid Mental Healing for Veterans are partnering with established programs like Reboot Recovery to offer, well, meaningful help.
Effective support, yeah.
Yeah. So if you're listening, maybe you're a veteran or you have family who served or you're just concerned, this deep dive should give you some important insights, into what's happening and what resources are available. So where do we start unpacking this?
I think the Defense Health Agency report is the place to start. It really sets the scene. Basically, it found nearly a 40% increase in mental health diagnoses.
Wow.
Yeah, among active duty service members just between 2019 and 2023.
40% in just 4 years. That's a massive jump. That's not just a slow creep.
No, it's not. And it gets more specific. Things like PTSD and anxiety disorders, they nearly doubled in that same time frame.
Doubled. Okay, that really highlights the specific kinds of, well, psychological weight our service members might be carrying.
It does. And the report, it does mention the COVID-19 pandemic as maybe one factor.
Makes sense. That affected everyone.
True, but it also makes you think about the ongoing stresses of military life itself. And maybe, just maybe, more people are willing to seek help now. Less stigma, so more diagnoses recorded.
That's a good point. It could be a mix of things.
Probably is.
And the impact on, hospital resources, that must be huge. I saw a stat that just jumped out at me in 2023. Over half, 54.8% of all hospital bed days for active duty folks were for mental health.
Yeah, more than half.
More than physical injuries or illnesses. That just shows how deep this goes.
It really does. And the sheer number of people. The report counted 541,672 active duty members diagnosed with at least one mental health disorder between 2019 and 2023.
Over 500,000 individuals.
And get this, almost half of them, about 47%, had multiple diagnoses.
Oh, wow.
Yeah, so that adds up to nearly 1 million total diagnoses, 966,227 to be exact. It shows how complex these struggles often are. They're often layered.
And I remember reading it wasn't spread evenly across the board either, right? There were demographic differences.
That's right. Higher rates were seen in female service members and also younger individuals. The Army had higher rates overall, but interestingly, the Navy actually led for specific things like depression.
Huh. So different branches, different demographics, maybe facing slightly different patterns of challenges?
Seems like it. And the point about female service members having PTSD diagnoses at twice the rate of males, that's really striking.
Yeah, twice the rate. The report suggested it might relate to more women serving and maybe some sex-specific differences and vulnerability factors. Needs tailored support, clearly.
Definitely. And then you layer on the tragic context of military suicides. Sadly, those numbers went up in 2023, continuing a really worrying trend.
Yeah.
And we know veterans are at a much higher risk, almost twice as likely to die by suicide compared to civilians. It just adds this layer of urgency.
It really does. It paints a tough picture. But it's good the report itself calls for, pushing help-seeking behavior. Just acknowledging the problem is step one.
For sure. And the DoD's definition is broad acute stress, bipolar, depression, anxiety, PTSD, schizophrenia. It covers a lot, showing the wide range of conditions needing attention.
Okay. So that sets the stage. A clear need. Which brings us to organizations trying to meet that need, like Reboot Recovery.
Exactly. Reboot is a faith-based group, and their whole mission is helping people overcome trauma, really empowering them to, move past it into a better future.
And their courses aren't just for military, right? They're open to anyone.
That's correct. Their main course is Trauma Reboot. It's 12 weeks, faith-based, peer-led, for anyone dealing with trauma.
Oh, led. That seems important.
Very. But they also have Military Reboot. Same model, 12 weeks, faith-based, peer-led, but specifically designed for veterans, active duty, and their families. It tackles that service-related trauma head-on.
That shared experience in the peer-led groups must be powerful. Less feeling alone with it all.
Precisely. And the results they report are pretty compelling. Things like families getting back together,
Oh, wow.
divorce rates dropping, people needing less medication, even suicide numbers falling among participants.
Those are significant outcomes. Not just feeling better, but real life changes.
Exactly. And they back it up with data. They use proper assessment tools, track progress. They've even published studies showing improved quality of life, better character resiliency, things like that.
So it's not just anecdotal stories, there's actual measurement behind it.
Right, which adds weight. Plus, they make it accessible. Online courses, e-books, daily challenges, virtual groups. They try to reach people wherever they are.
That's key. Okay, so Reboot has this established, data-backed program. Now let's talk about rapid mental healing for veterans, RMHFV. How do they fit in?
Well, their mission is right in line with everything we've discussed. Improving quality of life for veterans and families, ensuring access to good care. A big part of their philosophy is treating mental wounds just as seriously as physical ones.
As they should be. What kind of services do they offer directly?
They have quite a range. Rapid transformational therapy, that's for things like depression, anxiety, PTSD, even just navigating big life changes after service. And they do family counseling, too, supporting kids with behavior issues, recognizing the whole family unit is affected.
Right. It's rarely just the individual. Okay, and this is where the connection comes in, right? Their work with Reboot's program.
Yes, exactly. RMHFV specifically lists that they offer the Reboot Recovery Trauma, Reboot Combat Veterans First Responders course. They describe it just like Reboot does that 12-week faith-based, peer-led program for overcoming trauma.
So RMHFV is actively using and delivering the Reboot program to the veterans they serve.
That's clearly the picture. They're integrating this proven model directly into their offerings for veterans and first responders.
That makes so much sense. Taking a successful framework and bringing it into an organization laser-focused on the veteran community.
Precisely. And RMHSZ doesn't stop there. They add their own services on top of or alongside the Reboot course. Things like mental welfare coaching, modern meditation techniques, sound therapy, even art therapy.
Oh, interesting. So a really holistic approach.
Yeah, it seems like they're trying to offer a whole toolkit for well-being. And they stress making it high quality and accessible, no matter the veteran's specific status or role.
So looking at this partnership, it feels like a really strong combination. You've got Reboot's established effective trauma program
With those positive reported outcomes.
being delivered by RMHFV, an organization that really understands veterans.
And that adds its own supportive services, like that coaching and sound therapy you mentioned.
It creates this like comprehensive support system.
I think that's the goal. It potentially means reaching more veterans who need this kind of help, offering them a path that's been shown to work, delivered by people who get it.
And thinking back to those numbers, we started with that 40% rise, the doubling of PTSD and anxiety. This kind of collaboration feels like a really direct, proactive response. It's hopeful.
It is. It's practical action. And those extra services from RMHFV, the coaching, the sound healing, they could really complement the core Reboot work, making it even more impactful for some individuals.
Okay, so let's just quickly recap. We saw the data, a really sharp increase in mental health needs in the military.
A concerning trend, yeah.
Then we looked at Reboot Recovery, their faith-based, peer-led trauma courses, and the positive results they're seeing.
Proven results, backed by data.
And crucially, how rapid mental healing for veterans is partnering with them. RMHFV is bringing that Reboot program to veterans, but also adding their own layers of support, like mental health coaching and sound healing.
It highlights how vital, accessible, and effective mental health support is for everyone who's served. The need is clear, and it's genuinely good to see these kinds of focused, collaborative efforts happening. Those positive outcomes from Reboot offer real hope.
Absolutely. So wrapping this up and reflecting on everything, the rising need, these collaborative solutions like RMHFE delivering Reboot's program alongside their own therapies. Here's something to think about. Considering these partnerships and the diverse support being offered, what more can we do as communities, as individuals, to really boost these efforts? How can we make sure every veteran gets access not just to healing from trauma, but to building a truly fulfilling life after service? Something to chew on.